Doctor, I've been feeling awful. I've had a terrible headache for days and my stomach is killing me. I feel weak and dizzy and I can't seem to shake this fever.
The doctor, with a reassuring smile, gestured for her to sit down.
It's been about a week. It started with a mild fever and this nagging headache. Then came the stomach cramps and diarrhea. I thought it was just a bug, but it's only gotten worse.
The doctor, suspecting the culprit behind her misery, asked her a few more questions.
No, I haven't traveled abroad recently, but I did eat out a few times last week. Could that be it?
The doctor nodded thoughtfully, already piecing together the clues. Based on your symptoms and recent travels, the doctor began, his voice gentle yet firm, I suspect you might have typhoid fever. This is a condition that we often see in individuals who have traveled to areas where the disease is more common. The patient's eyes widened in alarm, the name alone conjuring up images of a debilitating illness. She had heard stories of people suffering greatly from it. Typhoid fever, he continued, is a bacterial infection caused by Salmonella typhi. This bacterium is typically spread through contaminated food and water. It's a serious condition, but with prompt diagnosis and treatment, we can get you back on your feet in no time. The key is to start treatment early to avoid complications. Seeing the fear in his patient's eyes, the doctor quickly reassured her. He knew that understanding the illness was the first step in alleviating her anxiety. Don't worry, he said, we'll run some tests to confirm the diagnosis. These tests will help us determine the best course of action for your treatment. But first, let me explain a bit more about typhoid so you can understand what we're dealing with. Typhoid fever can cause high fever, weakness, stomach pains, headache, and loss of appetite. The patient, still apprehensive, nodded slowly, eager to learn more about this illness that had brought her to the doctor's office. She wanted to know everything she could to fight it effectively. The doctor continued, explaining that, with proper antibiotics, most people start to feel better within a few days. However, it's crucial to complete the entire course of medication to ensure the bacteria are fully eradicated. The patient felt a glimmer of hope. She realized that with the doctor's guidance and the right treatment, she could overcome this illness. With a plan in place and a better understanding of what lay ahead, she felt more confident. The journey to recovery had begun, and she was ready to face it head-on. Typhoid fever is highly contagious, the doctor explained, leaning forward in his chair. It's caused by the bacterium Salmonella typhi, which can wreak havoc on the human body if not treated promptly. It spreads primarily through contaminated food and water. This contamination often occurs in areas with poor sanitation and limited access to clean water. He could see the patient's eyes widen slightly as she absorbed this information. The realization of how easily one could contract the disease was clearly unsettling. Imagine this, he continued. Someone infected with the bacteria handles food without washing their hands properly. This is a common scenario in many places where hygiene practices are not strictly followed. The bacteria then hitch a ride on the food, and when someone eats it, they ingest the bacteria and become infected. This is why it's so important to ensure that food is prepared in a clean environment. The same thing can happen with water, the doctor added. Contaminated water sources are a major concern, especially in rural areas where water treatment facilities may be lacking. If someone with typhoid uses a water source like a well, and that water isn't properly treated, it can contaminate the entire supply. This can lead to widespread outbreaks, affecting entire communities. He paused, letting the information sink in. The gravity of the situation was evident, and he wanted to ensure the patient fully understood the risks. So it's crucial to be mindful of hygiene, especially when traveling to areas where typhoid is more common, he concluded, emphasizing the importance of prevention. Simple measures like washing hands thoroughly, drinking bottled or boiled water, and eating food that is properly cooked can make a significant difference in preventing the spread of typhoid. Now, the doctor continued, let's talk about the culprit behind all this, the Salmonella typhi bacteria. This bacterium is the primary cause of typhoid fever, a serious and sometimes life-threatening illness. Understanding its nature is crucial for both prevention and treatment. He picked up a model of a bacterium, its intricate structure magnified for clarity. The model showcased the complex anatomy of the bacteria, highlighting its cell wall, flagella, and other components that contribute to its virulence. This tiny organism is responsible for wreaking havoc in your body, he explained, pointing to the various parts of the model. The doctor detailed how the bacteria invade the intestinal walls, enter the bloodstream, and spread to other organs, causing a range of symptoms from high fever to abdominal pain. Once inside, it multiplies rapidly in your intestines and bloodstream, leading to the symptoms you're experiencing. These symptoms can include prolonged fever, weakness, stomach pains, headache, and loss of appetite. In severe cases, it can lead to complications such as intestinal perforation or hemorrhage. The Salmonella typhi bacteria are incredibly resilient, he added. They can survive for weeks in water or dried sewage, making sanitation even more crucial in preventing the spread of the disease. Proper sanitation practices, such as boiling water, washing hands thoroughly, and avoiding contaminated food, are essential in controlling the spread. The doctor's words painted a vivid picture of the invisible enemy they were facing, emphasizing the importance of timely treatment and preventive measures. He stressed that early diagnosis and appropriate antibiotic treatment are vital in managing the infection and preventing serious complications. Additionally, vaccination can provide effective protection against typhoid fever, especially in areas where the disease is prevalent. The symptoms of typhoid fever can vary from person to person, the doctor explained, but some common signs include a high fever that can reach 103 to 104 degrees Fahrenheit, severe headache, stomach pain, constipation, or diarrhea. He noticed the patient nodding along, recognizing some of her own experiences. You might also feel extremely fatigued, lose your appetite, experience chills, sweating, muscle aches, he continued. In some cases, the doctor added, a rash of flat, rose-colored spots may appear on the chest and abdomen. He paused, allowing the patient to process the information. It's crucial to remember that early diagnosis and treatment are key to preventing serious complications, the doctor emphasized, his tone firm yet reassuring. The doctor, noticing the patient's concerned expression, decided to address a potential worry. Many people wonder about children and typhoid fever, he began, his voice calming. Children, especially those under 5, are particularly vulnerable to this infection, he explained. Their immune systems are still developing, making them more susceptible to the bacteria. The symptoms in children can be similar to adults, he continued, but they might also experience drowsiness, refusal to eat, and a slower heart rate than expected for their age. If you suspect your child might have typhoid fever, the doctor urged, it's crucial to seek medical attention immediately. Early intervention, he stressed, is vital in managing the illness in young children. Untreated typhoid fever can lead to serious complications, the doctor cautioned, his tone serious. The bacteria can spread from the intestines to the bloodstream, leading to a condition called typhoid septicemia. This is a life-threatening situation, he emphasized, and can cause damage to various organs including the heart, lungs, and brain. He saw the patient's face pale slightly at the mention of such severe consequences. Other complications include internal bleeding in the intestines, a perforated bowel, and inflammation of the pancreas or gallbladder, he added. However, with prompt treatment, these complications are rare. His words, while sobering, served as a stark reminder of the importance of addressing the illness head-on. To confirm the diagnosis, the doctor continued, we'll need to run a few tests. He explained that a blood culture could identify the presence of Salmonella typhi, while stool and urine samples could also be tested for the bacteria. Once we confirm the diagnosis, he reassured the patient, treatment is usually straightforward. He explained that antibiotics are the most effective way to eliminate the bacteria and typically need to be taken for 7 to 14 days. It's crucial to finish the entire course of antibiotics, he emphasized, even if you start feeling better before completing the prescribed dosage. This, he explained, ensured the bacteria were completely eradicated and reduced the risk of antibiotic resistance. Prevention is always better than cure, the doctor stated, shifting the focus to preventive measures. Vaccination is one of the most effective ways to protect yourself from typhoid fever, especially if you're traveling to areas where the disease is more prevalent. He explained that there are 2 types of typhoid vaccines, an injectable vaccine that provides protection for up to 2 years, and an oral vaccine taken in capsule form that lasts for up to 5 years. It's best to get vaccinated at least 2 weeks before your trip, he advised, to allow your body enough time to build immunity. Besides vaccination, there are several other precautions you can take to prevent typhoid fever, the doctor continued, emphasizing the importance of personal hygiene. Always wash your hands thoroughly with soap and water before eating or preparing food, and after using the toilet, he instructed. If soap and water aren't available, use an alcohol-based hand sanitizer. Be cautious about the food and water you consume. especially in areas where hygiene standards might be questionable, he added. Stick to bottled water, avoid ice in drinks, and opt for thoroughly cooked food.
Remember, the doctor said, offering a reassuring smile. Typhoid fever is treatable, and with the right precautions, it's also preventable.
He could see the fear in the patient's eyes start to dissipate as she absorbed the information and realized that her condition, while serious, was manageable.
We'll run the necessary tests, he concluded, and get you started on the appropriate treatment right away. In the meantime, focus on resting and staying hydrated.
With a renewed sense of hope and a plan in place, the patient left the doctor's office, feeling empowered and ready to fight back against the invisible enemy within.